assess safety and antibody response. The Moderna vaccine has been in phase 1 since mid-March. Phase 1 is only the first step to testing a vaccine, so the actual answer to whether or not either of these vaccines or any of the future vaccines is going to work will take about 12 to 18 months. On the treatment front, the results from the first remdesivir randomized controlled clinical trial in China should be out within a week or two. There are several trials on hydroxychloroquine that we hope will answer whether that works or not. And there is anecdotal evidence that using plasma from people who recover from COVID to treat those who are sick may work, and studies are starting. And to finish my comments, I do want to highlight a website that has information about COVID in multiple languages that you can refer your communities to. So I'm just going to share my screen and then actually finish here. So this is run by the researchers from Harvard. And as you can tell, they have fact sheet in multiple languages. And of course, if you have capability in languages that they don't have, they also welcome people's contribution to this website. Thank you.
And next, we are going to Kerry Talbot. She's the Director of Federal Advocacy for the Immigration Hub. She will speak about the 3 stimulus packages passed by Congress and the 4th one that it's in the early stages. Thank you, Kerry. Please go ahead.
Great. Thank you so much for having me. I really appreciate it. So the bills that have passed Congress so far have not provided enough economic support or health coverage for immigrants, including those who have DACA, TPS, and others. We're really concerned that during this crisis, people are not going to be able to access the health care that they need because they are not covered by emergency Medicaid. We really need to make sure that everyone has access to testing and treatment. Citizens, people are here with green cards, DACA folks, those with temporary protected status, and the undocumented, they all need to be able to go get tested and treated. Without that, we're just putting all of our communities at risk. So that's one of our main asks for the next package, because in the first few bills, there was a state option for Medicaid, but it did not cover undocumented immigrants, and it also didn't even cover recent green card holders or people with DACA and TPS. So that's one of the major asks. In addition, we are hoping that cash payments would go to immigrant families. Right now, as is the case with these past bills, they don't cover families that are in mixed status. So for example, if one parent is undocumented and one parent is a citizen and the kids are citizens, that family is not getting any money, not one penny, because there are undocumented people in the family. And so at the very least, Congress needs to make sure that people who were born here, they're citizens, they should have access to cash payments. And we believe undocumented individuals should as well. So many are doing essential services. You know, we have farm workers, we have people working in stores and restaurants, doing deliveries, and healthcare workers, and we need to make sure these folks are able to pay their rent and able to stay in their homes. So that's our second ask, is to make sure that cash payments go to all immigrant families. In addition, we're super concerned about the situation in detention. Immigrants in detention are at very high risk of getting coronavirus. We've heard many reports this week of individuals in ICE custody who have coronavirus, and they are living in very close quarters, and it's very dangerous for them. And so we're very concerned about that situation and think that individuals should be released, starting with people who are elderly or who have serious illnesses. They need to be let out of detention. So that's another thing that we're very concerned about. We were successful in the last few bills in making sure that DHS did not receive additional money, but we have not yet been successful in getting ICE to have a clear policy on enforcement, including letting people out of detention who should be let out, and also making sure that health and safety standards are followed, and also clarifying that people can go to the hospital and they're not going to be picked up for enforcement at the hospital. And then there are a few other things that were not covered in the past bills that we would like to go ahead and cover. Language access is always an issue. We want to make sure people who are being intubated or who are being put into the ICU understand what's happening to them, and that there's adequate interpretation services. And finally, we want to make sure that the public charge rule, which you all have probably heard quite a lot about, which is scaring immigrants from seeking healthcare, we want to make sure that it's very clear that immigrants are not going to be punished if they seek health services during this emergency. So really, the past bills, they have had pots of money for community health centers, for food banks, for other just general services, but they didn't really have specific provisions that would help immigrants. So there are some pots of money that will help, and definitely some immigrants can get tested for coronavirus at their local community health center. But we do want to make sure that people are able to get treatment as well, and that they have the economic support they need to be able to stay in their homes. Thank you so much.
Kerry, before we go ahead with the next speaker, I have a quick follow-up. So in the first three laws that were passed by Congress, what kinds of money are we seeing for healthcare, for services, et cetera, that people can have access to in the immigrant community, let's say legal residents, or let's say other vulnerable communities?
Yeah, there's been a lot of attention on small business relief, and actually this week Congress is going to probably push through even more money for small businesses, but it's not entirely clear whether undocumented individuals can benefit from that. And so we're hoping that folks can benefit, and I think people should apply for it, but it hasn't been crystal clear yet if that's really going to work for communities. There was a $3.3 billion increase for community health centers, and that's definitely helpful because people can find their local community health center and go there for testing. So that's very good. There's $450 million for food banks, which is good. $45 billion for a FEMA disaster relief fund, and I know in California and other areas, there are FEMA offices and sites opening up where people can try to get assistance. And I think immigrants should be able to access that. And then there's just general money for hospitals and health services, like $100 billion was in the last package for hospitals. So, that helps to pay their bills, which is definitely helpful, but it doesn't actually pay the individual bills for people going to the ICU who are going to get very large bills. So we just want to make sure that we cover them with emergency Medicaid.
Thank you so much for that. Very helpful.